Hello, future nurses. Welcome to Nursing Exam Preparation, your ultimate resource for acing the NCLEX. In today's video, we'll be covering 120 multiple-choice questions, MCQs, on diabetes care to help you prepare for the exam. We'll explore key topics such as pathophysiology of diabetes, type 1 versus type 2, insulin resistance, pharmacological management, insulin types, oral hypoglycemics, monitoring and assessment, blood glucose, HbA1c targets, patient education, diet, exercise, self-monitoring, acute and chronic complications, hypoglycemia, DKA, retinopathy, nursing interventions, preventing complications, patient compliance. Each question is followed by the correct answer and a detailed rationale to ensure you understand the concepts and can apply them in clinical settings. Whether you're starting your NCLEX journey or doing a final review, this video is packed with essential insights. Don't forget to like, share, and subscribe to Nursing Exam Preparation for more helpful content. Ready to get started? Let's dive into diabetes care and get you one step closer to passing your NCLEX. 1. Which of the following is the primary pathophysiological mechanism in type 1 diabetes? A. Insulin resistance. B. Insulin deficiency. C. Decreased glucagon secretion. D. Beta cell dysfunction. Answer: B. Insulin deficiency. Rationale: type 1 diabetes is characterized by autoimmune destruction of pancreatic beta cells, leading to an absolute insulin deficiency. In contrast, type 2 diabetes is characterized by insulin resistance and eventual beta cell dysfunction. 2. Which class of medications is most commonly prescribed for type 2 diabetes? A. Insulin. B. Sulfonylureas. C. GLP-1 receptor agonists. D. Biguanides. Answer: D. Biguanides. Rationale: biguanides, such as metformin, are first-line oral medications for type 2 diabetes. They decrease hepatic glucose production and improve insulin sensitivity. Insulin is more commonly prescribed for type 1 diabetes or uncontrolled type 2 diabetes. Rationale: biguanides, such as metformin, are first-line oral medications for type 2 diabetes. They decrease hepatic glucose production and improve insulin sensitivity. Insulin is more commonly prescribed for type 1 diabetes or uncontrolled type 2 diabetes. 3. A patient with diabetes is instructed to monitor their blood glucose levels at home. What is the target range for most adults with diabetes before meals? A. 90 to 130 mg/dl. B. 70 to 110 mg/dl. C. 120 to 150 mg/dl. D. 100 to 140 mg/dl. Answer: A. 90 to 130 mg/dl. Rationale: the American Diabetes Association, ADA, recommends a premeal blood glucose target range of 90 to 130 mg/dl for most adults with diabetes. This helps to maintain glucose control and reduce complications. Rationale: the American Diabetes Association, ADA, recommends a premeal blood glucose target range of 90 to 130 mg/dl for most adults with diabetes. This helps to maintain glucose control and reduce complications. 4. A nurse is teaching a diabetic patient about signs of hypoglycemia. Which of the following symptoms would be most consistent with hypoglycemia? A. Polydipsia. B. Nausea and vomiting. C. Sweating and trembling. D. Blurry vision. Answer: C. Sweating and trembling. Rationale: sweating and trembling are classic symptoms of hypoglycemia due to the body's release of stress hormones like epinephrine. Polydipsia and blurry vision are more common symptoms of hyperglycemia. Rationale: sweating and trembling are classic symptoms of hypoglycemia due to the body's release of stress hormones like epinephrine. Polydipsia and blurry vision are more common symptoms of hyperglycemia. 5. Which of the following is the primary goal in the management of diabetic ketoacidosis, DKA? A. Rapid weight loss. B. Fluid and electrolyte balance. C. Insulin withdrawal. D. Increased protein intake. Answer: B. Fluid and electrolyte balance. Rationale: the primary management goal in DKA is to restore fluid and electrolyte balance, as dehydration and acidosis are the most critical issues. Insulin is administered later to address hyperglycemia, but fluid and electrolyte correction comes first. Rationale: the primary management goal in DKA is to restore fluid and electrolyte balance, as dehydration and acidosis are the most critical issues. Insulin is administered later to address hyperglycemia, but fluid and electrolyte correction comes first. 6. What is the mechanism of action of metformin in the treatment of type 2 diabetes? A. Stimulates insulin secretion from the pancreas. B. Increases glucose uptake in the muscles. C. Decreases glucose production in the liver. D. Reduces insulin resistance in the liver. Answer: C. Decreases glucose production in the liver. Rationale: metformin primarily works by reducing hepatic glucose production and improving insulin sensitivity. It does not stimulate insulin secretion directly, which differentiates it from sulfonylureas. Rationale: metformin primarily works by reducing hepatic glucose production and improving insulin sensitivity. It does not stimulate insulin secretion directly, which differentiates it from sulfonylureas. 7. A patient with type 1 diabetes is being taught how to manage their blood glucose levels. Which of the following interventions is most appropriate for preventing diabetic ketoacidosis, DKA? A. Administering oral anti-diabetic agents. B. Insulin dose adjustment based on blood glucose levels. C. Reducing carbohydrate intake significantly. D. Skipping meals to avoid high blood glucose. Answer: B. Insulin dose adjustment based on blood glucose levels. Rationale: insulin dose adjustment is crucial for preventing DKA in type 1 diabetes, as insulin deficiency can lead to ketone production. Oral agents do not address insulin deficiency in type 1 diabetes. Rationale: insulin dose adjustment is crucial for preventing DKA in type 1 diabetes, as insulin deficiency can lead to ketone production. Oral agents do not address insulin deficiency in type 1 diabetes. 8. Which of the following long-term complications is most commonly associated with uncontrolled diabetes? A. Diabetic neuropathy. B. Diabetic ketoacidosis. C. Acute kidney injury. D. Non-healing wounds. Answer: A. Diabetic neuropathy. Rationale: diabetic neuropathy is one of the most common chronic complications of poorly controlled diabetes, affecting peripheral nerves. Acute kidney injury and DKA are more related to short-term issues or crises. Rationale: diabetic neuropathy is one of the most common chronic complications of poorly controlled diabetes, affecting peripheral nerves. Acute kidney injury and DKA are more related to short-term issues or crises. 9. A nurse is providing dietary education to a diabetic patient. Which of the following is the most appropriate recommendation for managing blood glucose levels? A. Avoid all carbohydrates. B. Follow a low-fat, high-protein diet. C. Focus on complex carbohydrates with a low glycemic index. D. Consume large meals twice daily. Answer: C. Focus on complex carbohydrates with a low glycemic index. Rationale: complex carbohydrates with a low glycemic index are digested more slowly, helping to prevent sharp increases in blood glucose. Avoiding carbohydrates altogether is not recommended as it can lead to nutrient deficiencies. Rationale: complex carbohydrates with a low glycemic index are digested more slowly, helping to prevent sharp increases in blood glucose. Avoiding carbohydrates altogether is not recommended as it can lead to nutrient deficiencies. 10. A patient with type 2 diabetes has been prescribed insulin for the first time. Which of the following is the most important consideration when teaching the patient about insulin administration? A. Injecting the insulin in the thigh only. B. Rotating injection sites to prevent lipodystrophy. C. Using insulin only when blood glucose levels are high. D. Administering insulin only during meals. Answer: B. Rotating injection sites to prevent lipodystrophy. Rationale: rotating injection sites helps prevent lipodystrophy, a condition that affects the absorption of insulin. The other options are incorrect because insulin should be injected in various areas, not just during meals or only when glucose is high. Rationale: rotating injection sites helps prevent lipodystrophy, a condition that affects the absorption of insulin. The other options are incorrect because insulin should be injected in various areas, not just during meals or only when glucose is high. 11. A diabetic patient is experiencing blurry vision and frequent urination. Which of the following conditions could these symptoms indicate? A. Diabetic ketoacidosis, DKA. B. Hypoglycemia. C. Hyperglycemia. D. Insulin resistance. Answer: C. Hyperglycemia. Rationale: blurry vision and frequent urination are common symptoms of hyperglycemia due to increased blood glucose levels. In contrast, DKA typically presents with fruity breath and dehydration, while hypoglycemia causes sweating and tremors. 12. What is the most important action for a nurse to take when caring for a diabetic patient who is experiencing hypoglycemia? A. Administer insulin immediately. B. Provide the patient with 15 to 20 grams of fast-acting carbohydrates. C. Encourage the patient to drink a large amount of water. D. Wait for the patient to recover on their own. Answer: B. Provide the patient with 15 to 20 grams of fast-acting carbohydrates. Rationale: for hypoglycemia, the first step is to provide 15 to 20 grams of fast-acting carbohydrates, e.g., glucose tablets or juice, to raise blood glucose levels. Administering insulin would worsen hypoglycemia, and waiting would delay treatment. 13. Which of the following insulin types is considered long-acting and is typically used to provide basal insulin coverage throughout the day and night? A. Insulin aspart. B. Insulin glargine. C. Regular insulin. D. Insulin lispro. Answer: B. Insulin glargine. Rationale: insulin glargine is a long-acting insulin used for basal coverage. It is typically injected once daily. Insulin aspart, lispro, and regular insulin are faster-acting insulins used around mealtime for bolus coverage. 14. A diabetic patient is having difficulty managing their weight. Which of the following interventions would be most beneficial in helping the patient achieve weight loss? A. Increase insulin dosage to promote fat storage. B. Encourage physical activity and a balanced, reduced-calorie diet. C. Avoid any form of exercise due to risk of hypoglycemia. D. Recommend a high-protein diet and avoid carbohydrates. Answer: B. Encourage physical activity and a balanced, reduced-calorie diet. Rationale: regular physical activity and a balanced, reduced-calorie diet are essential for weight loss. Insulin increases fat storage, and avoiding exercise or recommending restrictive diets may worsen blood glucose control. 15. A 55-year-old diabetic patient presents with numbness in their feet and hands. What complication is most likely causing these symptoms? A. Diabetic retinopathy. B. Diabetic neuropathy. C. Diabetic nephropathy. D. Diabetic ketoacidosis, DKA. Answer: B. Diabetic neuropathy. Rationale: diabetic neuropathy, a common complication of long-term uncontrolled diabetes, causes numbness, tingling, and pain in the extremities. Diabetic retinopathy affects vision, nephropathy affects kidney function, and DKA presents with different symptoms. 16. A nurse is reviewing the lab results of a diabetic patient. The patient's HbA1c is 9%. What does this indicate? A. Excellent blood glucose control. B. Poor blood glucose control. C. Prediabetes. D. The patient is in diabetic remission. Answer: B. Poor blood glucose control. Rationale: an HbA1c level of 9% indicates poor blood glucose control, as the ADA recommends an HbA1c target of less than 7% for most diabetic patients. Higher levels increase the risk of complications. 17. What is the mechanism of action of sulfonylureas in the treatment of type 2 diabetes? A. Increase insulin sensitivity in muscle cells. B. Stimulate the pancreas to release more insulin. C. Inhibit glucose production in the liver. D. Slow gastric emptying. Answer: B. Stimulate the pancreas to release more insulin. Rationale: sulfonylureas stimulate pancreatic beta cells to release more insulin, which helps to lower blood glucose levels. They do not increase insulin sensitivity, inhibit glucose production, or affect gastric emptying. 18. A diabetic patient is admitted with diabetic ketoacidosis, DKA. Which of the following interventions should the nurse prioritize? A. Administering a dose of oral anti-diabetic agents. B. Providing intravenous fluids and electrolytes. C. Reducing the patient's carbohydrate intake. D. Increasing the insulin dosage. Answer: B. Providing intravenous fluids and electrolytes. Rationale: the first priority in DKA management is restoring fluid and electrolyte balance, as dehydration and acidosis are critical issues. Insulin administration follows once fluid resuscitation begins. Oral medications are not used in DKA. 19. A nurse is teaching a diabetic patient about the importance of daily foot care. Which of the following instructions should the nurse provide? A. Soak feet in hot water for 15 minutes daily. B. Trim toenails in a curved shape to prevent ingrown nails. C. Check for cuts, blisters, and swelling every day. D. Massage feet daily with alcohol-based lotion. Answer: C. Check for cuts, blisters, and swelling every day. Rationale: diabetic patients are at increased risk for foot complications, so daily inspection of the feet for injuries, blisters, or signs of infection is essential. Soaking feet in hot water can cause burns, and alcohol-based lotions can dry out skin. 20. What is the recommended blood pressure target for most adults with diabetes to reduce the risk of cardiovascular complications? A. 140/90 mmHg. B. 120/80 mmHg. C. 160/100 mmHg. D. 130/80 mmHg. Answer: D. 130/80 mmHg. Rationale: the ADA recommends a target blood pressure of less than 130/80 mmHg for most adults with diabetes to help prevent cardiovascular complications. Blood pressure control is an essential aspect of managing diabetes-related risks. 21. Which of the following is a major risk factor for developing type 2 diabetes? A. Age less than 30 years. B. High blood pressure. C. Lack of physical activity. D. Low body mass index. Answer: C. Lack of physical activity. Rationale: physical inactivity is a major risk factor for type 2 diabetes as it contributes to insulin resistance. High blood pressure is a comorbidity, not a primary risk factor. 22. A diabetic patient is using a continuous glucose monitor, CGM. What is the primary advantage of using this device? A. It provides real-time blood glucose readings. B. It prevents the need for insulin injections. C. It eliminates the need for dietary modifications. D. It automatically adjusts insulin doses. Answer: A. It provides real-time blood glucose readings. Rationale: a CGM provides continuous glucose data to help manage blood sugar levels. It does not adjust insulin doses or eliminate the need for lifestyle modifications. 23. A diabetic patient with neuropathy reports difficulty feeling their feet. What is the nurse's priority intervention? A. Encourage the patient to perform foot exercises. B. Teach the patient to inspect their feet daily for injury. C. Suggest using a heating pad to relieve pain. D. Recommend wearing tight shoes to support the feet. Answer: B. Teach the patient to inspect their feet daily for injury. Rationale: diabetic neuropathy can impair sensation, increasing the risk of unnoticed foot injuries. Regular inspection is critical for early detection of problems. 24. Which of the following is the most appropriate diet for a patient with diabetes? A. High-protein, low-carbohydrate diet. B. Low-fat, low-protein, high-carbohydrate diet. C. Balanced diet with portion control and carbohydrate counting. D. High carbohydrate, low protein diet. Answer: C. Balanced diet with portion control and carbohydrate counting. Rationale: a balanced diet that includes controlled portions of carbohydrates is essential for managing diabetes. The other options are not balanced or sustainable for blood glucose control. 25. What is the most common cause of diabetic ketoacidosis, DKA? A. Insulin overdose. B. Inadequate insulin administration. C. Hypoglycemia. D. Stress-induced insulin resistance. Answer: B. Inadequate insulin administration. Rationale: DKA is most commonly caused by insufficient insulin, leading to hyperglycemia, ketone production, and acidosis. Stress can contribute, but inadequate insulin is the primary cause. 26. Which of the following is a common complication of poorly controlled diabetes? A. Hypothyroidism. B. Diabetic retinopathy. C. Rheumatoid arthritis. D. Asthma. Answer: B. Diabetic retinopathy. Rationale: diabetic retinopathy is a common complication of poorly controlled diabetes due to high blood sugar damaging the blood vessels in the eyes. The other conditions are not directly related to diabetes. 27. A diabetic patient is preparing for a colonoscopy. Which of the following should the nurse include in the patient's pre-procedure instructions? A. Hold all oral diabetic medications the day before the procedure. B. Continue all oral diabetic medications and eat a regular meal before the procedure. C. Discontinue insulin and avoid all fluids for 24 hours prior to the procedure. D. Increase insulin doses to cover for the fasting period. Answer: A. Hold all oral diabetic medications the day before the procedure. Rationale: oral diabetic medications may cause hypoglycemia during the fasting period. Insulin doses may need adjustment, but oral medications should be withheld. 28. A nurse is assessing a diabetic patient with a wound on their foot. What is the most important aspect of care for this patient? A. Administering 4 antibiotics. B. Performing a thorough foot inspection. C. Encouraging weight-bearing exercises. D. Elevating the affected leg. Answer: B. Performing a thorough foot inspection. Rationale: a thorough foot inspection is critical to assess the wound, prevent infection, and ensure proper healing. Antibiotics, exercises, and elevation are not the primary concern. 29. Which of the following is a symptom of diabetic hypoglycemia? A. Polyuria. B. Increased thirst. C. Shaking and sweating. D. Blurry vision. Answer: C. Shaking and sweating. Rationale: shaking and sweating are common symptoms of hypoglycemia due to low blood glucose levels. Polyuria and increased thirst are more typical of hyperglycemia. 30. What is the primary purpose of self-monitoring of blood glucose, SMBG, in diabetic patients? A. To prevent diabetic ketoacidosis, DKA. B. To monitor long-term blood glucose control. C. To adjust insulin dosages based on real-time data. D. To confirm diagnosis of diabetes. Answer: C. To adjust insulin dosages based on real-time data. Rationale: SMBG helps patients make immediate adjustments to their insulin regimen, which is crucial for daily blood glucose management. It does not diagnose or monitor long-term control like HbA1c. 31. A diabetic patient is starting metformin for type 2 diabetes. Which of the following side effects should the nurse educate the patient about? A. Weight gain. B. Hypoglycemia. C. Gastrointestinal upset. D. Fluid retention. Answer: C. Gastrointestinal upset. Rationale: metformin is known to cause gastrointestinal side effects, including nausea and diarrhea, especially when starting the medication. It does not typically cause weight gain, hypoglycemia, or fluid retention. 32. When teaching a diabetic patient about foot care, which of the following should the nurse emphasize? A. Apply hot compresses to relieve pain. B. Wear tight-fitting shoes to prevent blisters. C. Inspect feet daily for signs of injury. D. Soak feet daily in hot water. Answer: C. Inspect feet daily for signs of injury. Rationale: regular foot inspection is key to preventing complications in diabetic patients. Hot water and tight shoes can increase the risk of injury. 33. Which of the following types of insulin is considered rapid-acting and is typically used before meals? A. Insulin detamir. B. Insulin glargine. C. Insulin aspart. D. Insulin NPH. Answer: C. Insulin aspart. Rationale: insulin aspart is a rapid-acting insulin that is taken before meals to control postprandial blood glucose spikes. The other insulins are longer-acting. 34. Which of the following is an essential aspect of diabetes self-management education? A. Focusing solely on insulin administration. B. Educating about carbohydrate counting and portion control. C. Restricting fluid intake to prevent hyperglycemia. D. Emphasizing complete avoidance of sugar. Answer: B. Educating about carbohydrate counting and portion control. Rationale: education on carbohydrate counting and portion control is crucial to managing blood glucose levels. Avoiding sugar entirely is unnecessary, and insulin is only part of the management. 35. A diabetic patient is diagnosed with nephropathy. Which of the following should the nurse include in the care plan? A. Encourage a high-protein diet. B. Monitor blood pressure closely. C. Limit fluid intake to prevent dehydration. D. Avoid all forms of exercise. Answer: B. Monitor blood pressure closely. Rationale: controlling blood pressure is critical in preventing further kidney damage in diabetic nephropathy. A high-protein diet could exacerbate kidney damage, and exercise is generally encouraged with appropriate adjustments. 36. A patient with type 1 diabetes is diagnosed with diabetic ketoacidosis, DKA. What is the first intervention for this patient? A. Administering glucose intravenously. B. Giving insulin subcutaneously. C. Providing intravenous fluids. D. Initiating a low-carb diet. Answer: C. Providing intravenous fluids. Rationale: the first step in managing DKA is fluid resuscitation to correct dehydration and electrolyte imbalances before administering insulin. 37. A diabetic patient with a HbA1c of 9.2% asks what this level means. How should the nurse respond? A. This indicates good blood sugar control. B. This is a sign of poor blood sugar control. C. This is an excellent target range. D. This is normal for a person with diabetes. Answer: B. This is a sign of poor blood sugar control. Rationale: an HbA1c level above 7% indicates poor blood sugar control and increases the risk of complications. 38. Which of the following oral hypoglycemic agents works by increasing insulin sensitivity in peripheral tissues? A. Metformin. B. Glympuride. C. Pioglitazone. D. Sitagliptin. Answer: C. Pioglitazone. Rationale: pioglitazone works by increasing insulin sensitivity in peripheral tissues. Metformin also increases sensitivity, but through different mechanisms, and glympuride stimulates insulin release. 39. A diabetic patient is concerned about weight gain with insulin therapy. Which of the following actions should the nurse recommend? A. Increase exercise and adjust the insulin dosage as needed. B. Reduce carbohydrate intake significantly. C. Discontinue insulin therapy and try oral medications. D. Skip meals to reduce insulin needs. Answer: A. Increase exercise and adjust the insulin dosage as needed. Rationale: weight gain can be managed with increased physical activity and careful adjustment of insulin doses. Skipping meals or changing medication without guidance is not recommended. 40. A nurse is reviewing the medications for a type 2 diabetic patient. Which of the following classes of medications should be used cautiously in patients with kidney dysfunction? A. Sulfonylureas. B. DPP-4 inhibitors. C. SGLT2 inhibitors. D. Biguanides. Answer: D. Biguanides. Rationale: Biguanides, like metformin, should be used cautiously in patients with kidney dysfunction due to the risk of lactic acidosis. Other drug classes may require adjustments, but are generally safer for renal impairment. 41. A patient with type 1 diabetes asks the nurse about the purpose of the HbA1c test. How should the nurse respond? A. It measures your current blood glucose level. B. It shows your average blood glucose level over the past 2 to 3 months. C. It helps determine if you are at risk for diabetic ketoacidosis. D. It tells if you need more insulin immediately. Answer. B. It shows your average blood glucose level over the past 2 to 3 months. Rationale. HbA1c reflects long-term glucose control and provides an average blood glucose level over 2 to 3 months. 42. Which of the following interventions is most important when caring for a patient with diabetic retinopathy? A. Encourage regular eye exams. B. Administer eye drops to relieve dryness. C. Teach the patient about foot care. D. Recommend smoking cessation. Answer. A. Encourage regular eye exams. Rationale. Regular eye exams are essential for detecting and managing diabetic retinopathy early, preventing further damage to the eyes. 43. A patient with diabetes is admitted with diabetic ketoacidosis, DKA. What is the primary goal of treatment in this condition? A. To increase blood glucose levels. B. To correct the acidosis and dehydration. C. To increase insulin resistance. D. To prevent weight loss. Answer. B. To correct the acidosis and dehydration. Rationale. The primary goal in treating DKA is to correct dehydration and acidosis through fluid resuscitation and insulin administration. 44. Which of the following symptoms is most commonly associated with hyperglycemia? A. Tremors and sweating. B. Fatigue and increased thirst. C. Shaking and dizziness. D. Shortness of breath and palpitations. Answer. B. Fatigue and increased thirst. Rationale. Hyperglycemia typically presents with symptoms like fatigue, increased thirst, and polyuria. Tremors and sweating are more common in hypoglycemia. 45. A diabetic patient is prescribed an insulin regimen consisting of insulin glargine and insulin aspart. Which of the following statements is correct regarding this regimen? A. Insulin glargine is a long-acting insulin, and insulin aspart is rapid-acting. B. Both insulin types are fast-acting and should be taken together. C. Insulin glargine is used for correction doses, while insulin aspart is basal insulin. D. Insulin glargine is taken before meals, while insulin aspart is taken once daily. Answer. A. Insulin glargine is a long-acting insulin, and insulin aspart is rapid-acting. Rationale. Insulin glargine provides basal insulin control over 24 hours, while insulin aspart is used to control postprandial blood glucose levels. 46. What is the first-line treatment for a patient newly diagnosed with type 2 diabetes? A. Insulin therapy. B. Lifestyle modifications and oral hypoglycemics. C. Combination insulin and oral agents. D. Bariatric surgery. Answer. B. Lifestyle modifications and oral hypoglycemics. Rationale. The first-line treatment for type 2 diabetes includes lifestyle changes, diet, exercise, and oral medications, like metformin. Insulin is typically added later if needed. 47. Which of the following factors most commonly causes hypoglycemia in diabetic patients? A. High blood sugar levels. B. Excessive carbohydrate intake. C. Skipping meals or inadequate food intake. D. Stress or illness. Answer. C. Skipping meals or inadequate food intake. Rationale. Skipping meals or inadequate food intake, especially with insulin or oral medications, can lead to hypoglycemia. Stress can increase glucose, not decrease it. 48. What is the primary mechanism of action of sulfonylureas in managing type 2 diabetes? A. Stimulating insulin secretion from the pancreas. B. Improving insulin sensitivity in peripheral tissues. C. Inhibiting glucose production in the liver. D. Delaying carbohydrate absorption in the intestines. Answer: A. Stimulating insulin secretion from the pancreas. Rationale: sulfonylureas stimulate the pancreas to release more insulin, thus lowering blood glucose levels. 49. What is the primary concern when administering insulin to a diabetic patient? A. Hyperkalemia. B. Hyperglycemia. C. Hypoglycemia. D. Hypertension. Answer: C. Hypoglycemia. Rationale: the most immediate concern when administering insulin is hypoglycemia due to insulin's ability to lower blood glucose levels. 50. A diabetic patient is receiving an insulin infusion for hyperglycemia. What is the most important nursing intervention during insulin administration? A. Monitor for signs of hypoglycemia. B. Increase fluid intake to dilute the insulin. C. Check vital signs every 4 hours. D. Administer additional doses of insulin for correction. Answer: A. Monitor for signs of hypoglycemia. Rationale: when insulin is administered, especially intravenously, there is a risk for hypoglycemia and the patient should be monitored closely for signs and symptoms. 51. A patient is diagnosed with diabetic neuropathy. Which of the following is a common symptom of this complication? A. Blurry vision. B. Numbness or tingling in the feet. C. Chest pain. D. Shortness of breath. Answer: B. Numbness or tingling in the feet. Rationale: diabetic neuropathy commonly causes numbness or tingling in the extremities, particularly the feet, due to nerve damage from prolonged high blood glucose levels. 52. Which of the following is a potential side effect of thiazolidinediones, TZDs, used in type 2 diabetes management? A. Hyperkalemia. B. Weight loss. C. Fluid retention and edema. D. Hypoglycemia. Answer: C. Fluid retention and edema. Rationale: TZDs like pioglitazone can cause fluid retention and edema, which can lead to heart failure in susceptible individuals. 53. A diabetic patient is experiencing symptoms of hypoglycemia. What should the nurse recommend? A. Drink a glass of milk. B. Drink a glass of fruit juice or eat a glucose tablet. C. Wait and see if symptoms subside. D. Take a dose of insulin to lower blood glucose. Answer: B. Drink a glass of fruit juice or eat a glucose tablet. Rationale: for hypoglycemia, quick sources of glucose such as juice or glucose tablets should be consumed to rapidly raise blood glucose levels. 54. A diabetic patient reports blurry vision and difficulty seeing at night. What is the most likely cause of these symptoms? A. Diabetic neuropathy. B. Diabetic retinopathy. C. Diabetic nephropathy. D. Hyperglycemia. Answer: B. Diabetic retinopathy. Rationale: diabetic retinopathy can cause blurry vision and difficulty seeing at night due to damage to the blood vessels in the retina. 55. Which of the following is the best approach for teaching a diabetic patient about insulin injection sites? A. Rotate injection sites to prevent lipodystrophy. B. Use the same site every time for consistent absorption. C. Inject insulin directly into muscle tissue for better absorption. D. Inject insulin only in the abdomen for quicker effect. Answer: A. Rotate injection sites to prevent lipodystrophy. Rationale: rotating injection sites prevents lipodystrophy, fat buildup under the skin, and ensures consistent absorption of insulin. 56. A diabetic patient is concerned about managing their condition during travel. Which advice is most appropriate for the nurse to provide? A. Avoid eating any snacks during the trip. B. Carry extra medication and monitor blood glucose levels frequently. C. Discontinue insulin therapy during travel. D. Skip meals to prevent high blood sugar. Answer: B. Carry extra medication and monitor blood glucose levels frequently. Rationale: it is important for the diabetic patient to carry extra medications, monitor blood glucose levels, and adjust their regimen as needed during travel. 57. What is the first step in managing a diabetic patient who presents with signs of diabetic ketoacidosis, DKA? A. Administer oral glucose. B. Provide intravenous fluids and insulin. C. Begin oral anti-diabetic medications. D. Perform a full physical assessment. Answer: B. Provide intravenous fluids and insulin. Rationale: fluid resuscitation and insulin administration are the first priorities in managing DKA to correct dehydration and reduce blood glucose levels. 58. Which of the following oral medications works by delaying the absorption of carbohydrates from the gastrointestinal tract? A. Metformin. B. Acarbose. C. Glympyride. D. Sitagliptin. Answer: B. Acarbose. Rationale: acarbose works by delaying carbohydrate absorption in the intestines, helping to prevent postprandial hyperglycemia. 59. A diabetic patient is starting to experience symptoms of hypoglycemia after insulin administration. What should the nurse recommend as an immediate intervention? A. Administer a quick-acting carbohydrate such as glucose. B. Encourage the patient to drink water. C. Give the patient a dose of long-acting insulin. D. Increase the patient's food intake for the rest of the day. Answer: A. Administer a quick-acting carbohydrate such as glucose. Rationale: a quick-acting carbohydrate like glucose is the first intervention for hypoglycemia to raise blood glucose levels quickly. 60. When teaching a diabetic patient about foot care, the nurse should emphasize which of the following? A. Only inspect feet when there is pain. B. Wash feet with hot water to improve circulation. C. Avoid wearing shoes that don't fit properly. D. Cut toenails in a curved shape. Answer: C. Avoid wearing shoes that don't fit properly. Rationale: proper foot care is essential for diabetic patients to prevent injuries and infections, including wearing well-fitting shoes to avoid blisters and sores. 61. Which of the following factors contributes most to insulin resistance in type 2 diabetes? A. Physical activity. B. Obesity, particularly abdominal fat. C. Hypoglycemia. D. Chronic use of corticosteroids. Answer: B. Obesity, particularly abdominal fat. Rationale: obesity, especially abdominal fat, is a key factor in insulin resistance because it interferes with insulin action and increases inflammation. 62. A patient with type 1 diabetes is about to undergo surgery. What should be the nurse's priority intervention regarding insulin administration during the perioperative period? A. Administer extra insulin to prevent hyperglycemia. B. Withhold all insulin to prevent hypoglycemia. C. Administer a reduced dose of insulin to prevent hyperglycemia. D. Continue regular insulin doses without modification. Answer: C. Administer a reduced dose of insulin to prevent hyperglycemia. Rationale: during surgery, insulin requirements are reduced, so it's important to adjust insulin doses to prevent hyperglycemia while still maintaining some insulin coverage. 63. What is the best way for a diabetic patient to manage blood glucose levels during exercise? A. Skip exercise if blood glucose is high. B. Increase insulin before exercise to prevent hypoglycemia. C. Consume a carbohydrate snack before or during exercise if blood glucose is low. D. Decrease carbohydrate intake before exercise. Answer: C. Consume a carbohydrate snack before or during exercise if blood glucose is low. Rationale: exercise can lower blood glucose levels, so consuming carbohydrates can help prevent hypoglycemia during or after exercise, especially for those on insulin therapy. 64. A diabetic patient with hypertension is prescribed an ACE inhibitor. What is the rationale for this prescription? A. ACE inhibitors help to prevent kidney damage in diabetics. B. ACE inhibitors lower blood glucose levels. C. ACE inhibitors improve insulin sensitivity. D. ACE inhibitors increase renal filtration rate. Answer: A. ACE inhibitors help to prevent kidney damage in diabetics. Rationale: ACE inhibitors protect the kidneys by reducing glomerular pressure, which is especially beneficial in diabetic patients to prevent diabetic nephropathy. 65. A patient with diabetes asks the nurse about the use of insulin pens. Which statement by the nurse is most accurate? A. Insulin pens are only used for rapid-acting insulin. B. Insulin pens are easy to use and allow for more accurate dosing. C. You should always mix your insulin before using an insulin pen. D. Insulin pens are only suitable for type 1 diabetes patients. Answer. B. Insulin pens are easy to use and allow for more accurate dosing. Rationale. Insulin pens are convenient for both type 1 and type 2 diabetes, offering precise doses and ease of use, especially in patients who need multiple injections. 66. What is the primary goal when managing a patient with diabetic nephropathy? A. To control blood glucose levels and prevent kidney failure. B. To increase fluid intake to prevent dehydration. C. To provide adequate protein to support kidney function. D. To reduce blood pressure and improve kidney filtration. Answer. A. To control blood glucose levels and prevent kidney failure. Rationale. The primary goal in managing diabetic nephropathy is to control blood glucose and blood pressure to prevent further kidney damage and potential kidney failure. 67. Which of the following is the most common cause of hypoglycemia in diabetic patients treated with insulin? A. Eating too much food. B. Skipping meals. C. Physical activity. D. Excessive alcohol consumption without food. Answer. B. Skipping meals. Rationale. Skipping meals or not eating enough while taking insulin can cause hypoglycemia because insulin lowers blood glucose levels and without food, glucose levels drop too low. 68. A patient with type 2 diabetes is prescribed metformin. Which statement by the patient indicates a need for further education? A. I should take this medication with meals to prevent stomach upset. B. This medication helps my body use insulin more effectively. C. I will take this medication every day, even if I feel fine. D. I should stop taking this medication if I feel low blood sugar. Answer. D. I should stop taking this medication if I feel low blood sugar. Rationale. Metformin does not cause hypoglycemia, so it should not be stopped when feeling low blood sugar. It works by improving insulin sensitivity, not by lowering blood sugar directly. 69. A diabetic patient with retinopathy is asking about ways to prevent further damage to the eyes. Which of the following is the most important recommendation? A. Perform regular eye exams to monitor for changes. B. Eat a diet high in vitamin A and C. Exercise regularly to improve circulation. D. Avoid using electronic devices for prolonged periods. Answer. A. Perform regular eye exams to monitor for changes. Rationale. Regular eye exams are crucial in monitoring and detecting changes in diabetic retinopathy early, enabling timely interventions to prevent progression. 70. What should a nurse do when administering insulin to a patient who is not eating and is at risk for hypoglycemia? A. Administer a full dose of insulin as prescribed. B. Reduce the insulin dose or withhold insulin. C. Administer the usual insulin dose and encourage the patient to eat. D. Give the patient oral glucose and proceed with insulin administration. Answer. B. Reduce the insulin dose or withhold insulin. Rationale. If the patient is not eating, insulin should be adjusted to avoid hypoglycemia. The nurse should either reduce the dose or withhold insulin based on blood glucose levels. 71. Which of the following is an indication that a diabetic patient may be developing diabetic ketoacidosis, DKA? A. Dehydration and fruity smelling breath. B. Fatigue and increased thirst. C. Increased urination and weight loss. D. Blurry vision and foot ulcers. Answer. A. Dehydration and fruity smelling breath. Rationale. DKA commonly presents with signs like dehydration, fruity smelling breath due to acetone, and abdominal pain. 72. Which of the following is an essential intervention when educating a diabetic patient about self-monitoring of blood glucose, SMBG? A. Teach the patient to monitor blood glucose only when feeling symptoms of hypoglycemia. B. Instruct the patient to monitor blood glucose at least 4 times a day. C. Advise the patient to check blood glucose only after meals. D. Encourage the patient to monitor blood glucose only during illness. Answer: B. Instruct the patient to monitor blood glucose at least 4 times a day. Rationale: SMBG is vital for managing diabetes, and checking blood glucose multiple times daily, especially before meals and at bedtime, helps with adjusting medication and diet. 73. A diabetic patient is concerned about foot care. What is the most important piece of advice the nurse can give? A. Soak feet in hot water every day. B. Inspect feet daily for cuts, blisters, and redness. C. Massage feet with lotion to improve circulation. D. Trim toenails in a curved shape to avoid injury. Answer: B. Inspect feet daily for cuts, blisters, and redness. Rationale: daily foot inspection is essential for detecting early signs of infection or injury, as diabetic patients may have reduced sensation and circulation in their feet. 74. Which of the following best describes the action of the medication liraglutide, Victoza, in managing type 2 diabetes? A. It increases insulin production by the pancreas. B. It inhibits the liver's production of glucose. C. It reduces insulin resistance in peripheral tissues. D. It mimics the effects of incretin hormones to enhance insulin secretion. Answer: D. It mimics the effects of incretin hormones to enhance insulin secretion. Rationale: liraglutide is a GLP-1 receptor agonist that mimics incretin hormones, promoting insulin secretion and inhibiting glucagon release, helping control blood glucose. 75. A diabetic patient is about to start insulin therapy. Which statement by the nurse is most appropriate? A. You should monitor your blood glucose levels after taking insulin. B. You should avoid eating after taking insulin. C. Insulin will increase your blood glucose level. D. You can stop monitoring your blood glucose once you start insulin. Answer: A. You should monitor your blood glucose levels after taking insulin. Rationale: regular monitoring of blood glucose is essential when starting insulin therapy to adjust doses and prevent hypo or hyperglycemia. 76. Which of the following complications is most likely to occur in a diabetic patient with uncontrolled blood glucose levels? A. Diabetic ketoacidosis. B. Pulmonary embolism. C. Liver failure. D. Deep vein thrombosis. Answer: A. Diabetic ketoacidosis. Rationale: uncontrolled blood glucose can lead to diabetic ketoacidosis, a potentially life-threatening condition characterized by dehydration, acidosis, and ketosis. 77. A diabetic patient with frequent urinary tract infections, UTIs, is concerned about their recurring infections. What is the nurse's most appropriate response? A. You may need to reduce your fluid intake to prevent UTIs. B. Poorly controlled diabetes can increase your risk of infections. C. UTIs are unrelated to diabetes. D. Take antibiotics regularly to prevent UTIs. Answer: B. Poorly controlled diabetes can increase your risk of infections. Rationale: high blood glucose levels can impair the immune system, making diabetics more susceptible to infections, including UTIs. 78. Which of the following is a sign of diabetic neuropathy? A. Numbness and tingling in the extremities. B. Unexplained weight gain. C. Increased hunger and thirst. D. Frequent urination. Answer: A. Numbness and tingling in the extremities. Rationale: diabetic neuropathy affects nerves, leading to symptoms such as numbness, tingling, and pain, often in the feet or hands. 79. Which laboratory test is used to monitor long-term blood glucose control in diabetic patients? A. Random blood glucose test. B. Fasting blood glucose test. C. Hemoglobin A1C test. D. Oral glucose tolerance test. Answer: C. Hemoglobin A1C test. Rationale: the hemoglobin A1C test provides an average of blood glucose levels over the past 2 to 3 months and is used to assess long-term glucose control. 80. A patient with diabetes asks the nurse about the role of exercise in managing diabetes. The nurse should explain that exercise helps by A. Increasing insulin resistance. B. lowering blood glucose and improving insulin sensitivity. C. Increasing blood glucose levels. D. Reducing the need for insulin. Answer. B. Lowering blood glucose and improving insulin sensitivity. Rationale: regular exercise improves insulin sensitivity and helps lower blood glucose levels, which is beneficial in managing both type 1 and type 2 diabetes. 81. A diabetic patient is experiencing polyuria and polydipsia. What is the nurse's primary concern? A. Hyperglycemia leading to dehydration. B. Hypoglycemia leading to shock. C. Dehydration due to excessive fluid intake. D. Electrolyte imbalance from excessive urination. Answer. A. Hyperglycemia leading to dehydration. Rationale: polyuria and polydipsia are classic signs of hyperglycemia, leading to excessive urination and thirst, which can result in dehydration. 82. A diabetic patient with a blood glucose of 350 milligrams per deciliter and ketonuria presents to the clinic. What condition should the nurse suspect? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Hypoglycemia. D. Diabetic retinopathy. Answer. A. Diabetic ketoacidosis, DKA. Rationale: DKA is characterized by hyperglycemia, ketonuria, and dehydration. It typically occurs in type 1 diabetes and requires urgent medical treatment. Answer. A. Diabetic ketoacidosis, DKA. Rationale: DKA is characterized by hyperglycemia, ketonuria, and dehydration. It typically occurs in type 1 diabetes and requires urgent medical treatment. 83. Which of the following is the most important teaching point for a diabetic patient about foot care? A. Apply heating pads to improve circulation in your feet. B. Trim toenails in a curved shape to avoid ingrown nails. C. Inspect your feet daily for signs of injury or infection. D. Soak your feet in hot water every night to keep them soft. Answer. C. Inspect your feet daily for signs of injury or infection. Rationale: daily foot inspection is crucial for preventing complications like infections and ulcers, which are common in diabetics. 84. A patient with type 2 diabetes is started on a sulfonylurea. What is the primary action of this medication? A. It decreases the liver's glucose production. B. It increases insulin secretion from the pancreas. C. It reduces insulin resistance in peripheral tissues. D. It inhibits glucose absorption in the intestines. Answer. B. It increases insulin secretion from the pancreas. Rationale: sulfonylureas stimulate the pancreas to release more insulin, which helps lower blood glucose levels in type 2 diabetes. 85. A diabetic patient is prescribed glargine insulin. When should this medication be administered? A. Before meals to control postprandial blood glucose. B. At bedtime for a consistent 24-hour insulin level. C. Only when blood glucose levels exceed 200 milligrams per deciliter. D. Twice daily for consistent basal insulin coverage. Answer. B. At bedtime for a consistent 24-hour insulin level. Rationale: glargine is a long-acting insulin that provides a steady level of insulin over 24 hours, typically administered at bedtime for basal coverage. 86. A patient with diabetes is experiencing blurred vision, dizziness, and shakiness. What is the nurse's first action? A. Administer insulin to reduce blood glucose. B. Check the patient's blood glucose level. C. Encourage the patient to rest in a dark, quiet room. D. Provide a high-protein snack to stabilize blood sugar. Answer. B. Check the patient's blood glucose level. Rationale: blurred vision, dizziness, and shakiness are symptoms of hypoglycemia or hyperglycemia, so it's important to check the blood glucose first to determine the cause. 87. A patient with diabetes is using an insulin pump. Which statement indicates that the patient understands proper use of the pump? A. I can remove the insulin pump when I feel like it. B. I need to change the infusion site every 3 to 4 days. C. I can take insulin from the pump whenever my blood sugar is high. D. I should only use the insulin pump with meals. Answer. B. I need to change the infusion site every 3 to 4 days. Rationale. Infusion sites for insulin pumps need to be changed regularly, every 3 to 4 days, to prevent infection and ensure proper insulin delivery. 88. A patient with diabetes asks the nurse about the role of dietary changes in managing blood glucose. Which of the following is the nurse's most appropriate response? A. Eat a high-carbohydrate diet to prevent hypoglycemia. B. A balanced diet with complex carbohydrates and fiber can help control blood glucose levels. C. Limit all fat intake to manage diabetes effectively. D. Reduce protein intake to avoid kidney damage. Answer. B. A balanced diet with complex carbohydrates and fiber can help control blood glucose levels. Rationale. A balanced diet rich in fiber and complex carbohydrates helps control blood glucose levels by slowing digestion and absorption. 89. A patient with diabetes is at risk for developing diabetic neuropathy. Which of the following is the most important intervention to prevent this complication? A. Strict blood glucose control. B. Daily foot inspections. C. Use of compression stockings. D. Increased vitamin B12 intake. Answer. A. Strict blood glucose control. Rationale. Strict blood glucose control reduces the risk of diabetic neuropathy by minimizing damage to the nerves caused by prolonged hyperglycemia. 90. A diabetic patient with an A1C of 7.5% asks if this is a good result. What should the nurse explain? A. This is below the target for most diabetics. B. An A1C level of 7.5% is excellent and shows good control. C. This indicates that your blood glucose control needs improvement. D. An A1C of 7.5% is too high for someone with diabetes. Answer. C. This indicates that your blood glucose control needs improvement. Rationale. The goal for most diabetics is an A1C of less than 7%. An A1C of 7.5% suggests that blood glucose control needs improvement. 91. A patient with type 1 diabetes reports recent weight loss despite eating more food than usual. What is the most likely explanation? A. Diabetic ketoacidosis. B. Insulin resistance. C. Overuse of insulin. D. Thyroid dysfunction. Answer. A. Diabetic ketoacidosis. Rationale. Weight loss in type 1 diabetes with increased food intake is often a sign of diabetic ketoacidosis, where the body starts breaking down fat for energy due to insufficient insulin. 92. Which of the following interventions is most important when managing a patient with diabetic foot ulcers? A. Maintain strict bed rest to prevent pressure on the foot. B. Clean the wound with alcohol to prevent infection. C. Monitor blood glucose levels to improve wound healing. D. Apply pressure bandages to prevent bleeding. Answer. C. Monitor blood glucose levels to improve wound healing. Rationale. Good blood glucose control is essential for wound healing in diabetics. Hyperglycemia can impair the immune system and slow healing. 93. A diabetic patient is being treated for hypertension with an angiotensin-converting enzyme, ACE, inhibitor. What is the nurse's priority assessment? A. Monitor for hypokalemia. B. Assess for signs of hyperglycemia. C. Monitor renal function and potassium levels. D. Assess blood pressure before each dose. Answer. C. Monitor renal function and potassium levels. Rationale. ACE inhibitors can affect renal function and potassium levels, so regular monitoring is important to avoid complications such as hyperkalemia and renal failure. 94. A diabetic patient is scheduled for a routine eye exam. What is the nurse's primary role in preparing the patient for the exam? A. Encourage the patient to fast for 12 hours before the exam. B. Ensure the patient has adequate transportation to the appointment. C. Explain the importance of eye exams in preventing diabetic retinopathy. D. Instruct the patient to avoid eye drops before the exam. Answer. C. Explain the importance of eye exams in preventing diabetic retinopathy. Rationale. Regular eye exams are essential for detecting diabetic retinopathy early and preventing vision loss. 95. A diabetic patient is experiencing hypoglycemia. Which of the following is the nurse's first intervention? A. Administer a dose of insulin to correct the hypoglycemia. B. Give the patient a fast-acting carbohydrate such as juice. C. Assess the patient's blood glucose level immediately. D. Give the patient a high-protein snack to prevent further hypoglycemia. Answer: B. Give the patient a fast-acting carbohydrate such as juice. Rationale: the first intervention in hypoglycemia is to provide a fast-acting carbohydrate to raise blood glucose levels quickly. 96. A diabetic patient asks the nurse about the effects of alcohol on blood glucose. What should the nurse explain? A. Alcohol increases blood glucose levels significantly. B. Alcohol has no effect on blood glucose levels. C. Alcohol can cause a sudden drop in blood glucose levels. D. Alcohol should be avoided completely in diabetes. Answer: C. Alcohol can cause a sudden drop in blood glucose levels. Rationale: alcohol can cause a delay in the liver's release of glucose, which can lead to hypoglycemia, especially in those on insulin or sulfonylureas. 97. A diabetic patient is prescribed a new medication to reduce blood glucose. Which of the following is an example of a medication that lowers blood glucose by increasing insulin sensitivity? A. Metformin. B. Insulin glargine. C. Glipizide. D. Pioglitazone. Answer: D. Pioglitazone. Rationale: pioglitazone is a thiazolide median that improves insulin sensitivity, helping to lower blood glucose in type 2 diabetes. 98. A diabetic patient is receiving education on the symptoms of hyperglycemia. Which symptom should the nurse include in the teaching? A. Shakiness. B. Sweating. C. Increased thirst. D. Dizziness. Answer: C. Increased thirst. Rationale: increased thirst, polydipsia, is a common symptom of hyperglycemia due to fluid loss from excessive urination. 99. A patient with type 1 diabetes is at risk for diabetic ketoacidosis, DKA. Which of the following factors should the nurse monitor closely to prevent this condition? A. Hyperglycemia and ketonuria. B. Blood pressure and pulse. C. Electrolyte levels and renal function. D. Bowel sounds and abdominal tenderness. Answer: A. Hyperglycemia and ketonuria. Rationale: DKA is characterized by hyperglycemia, ketonuria, and dehydration. Early identification of these signs is crucial for prevention. 100. Which of the following is the priority nursing intervention for a patient experiencing diabetic ketoacidosis, DKA? A. Administer insulin to lower blood glucose. B. Rehydrate the patient with 4 fluids. C. Monitor blood glucose levels frequently. D. Administer potassium supplements. Answer: B. Rehydrate the patient with 4 fluids. Rationale: fluid resuscitation is the priority in DKA to correct dehydration and restore electrolyte balance before administering insulin. 101. A diabetic patient is being discharged and asks about the best time to test their blood glucose. What is the nurse's best response? A. Test your blood glucose in the morning before breakfast. B. Test your blood glucose 2 hours after eating a meal. C. Test your blood glucose before meals to assess insulin needs. D. Test your blood glucose at random times throughout the day. Answer: A. Test your blood glucose in the morning before breakfast. Rationale: testing blood glucose before meals, especially in the morning, helps determine fasting blood glucose levels and insulin needs. 102. A diabetic patient is experiencing dry skin and blurred vision. What should the nurse consider as a possible cause? A. Hypoglycemia. B. Diabetic neuropathy. C. Hyperglycemia. D. Diabetic retinopathy. Answer: C. Hyperglycemia. Rationale: hyperglycemia can cause dehydration, leading to dry skin, and can also affect the eyes, resulting in blurred vision. 103. A patient with type 2 diabetes is on metformin. Which of the following is the most common side effect of this medication? A. Hypoglycemia. B. Diarrhea. C. Weight gain. D. Blurred vision. Answer: B. Diarrhea. Rationale: metformin commonly causes gastrointestinal side effects such as diarrhea, especially when starting the medication. 104. A diabetic patient is preparing to travel internationally. Which of the following should the nurse advise the patient to do? A. Bring extra insulin and supplies in case of delays. B. Avoid eating while traveling to prevent hypoglycemia. C. Take extra doses of insulin before the trip to prevent hyperglycemia. D. Adjust the insulin regimen only after reaching the destination. Answer: A. Bring extra insulin and supplies in case of delays. Rationale: when traveling, it's important to bring extra insulin and supplies to manage any unexpected delays or changes in schedule. 105. Which of the following is a common symptom of diabetic neuropathy? A. Chest pain. B. Numbness and tingling in the feet. C. Severe abdominal pain. D. Sudden loss of vision. Answer: B. Numbness and tingling in the feet. Rationale: diabetic neuropathy commonly affects the feet, causing numbness, tingling, and sometimes pain. 106. A diabetic patient is scheduled for a physical exam and blood work. Which of the following is the most important test to assess long-term blood glucose control? A. Serum creatinine. B. Hemoglobin A1C. C. Serum cholesterol. D. Blood urea nitrogen (BUN). Answer: B. Hemoglobin A1C. Rationale: hemoglobin A1C reflects long-term blood glucose control over the past 2 to 3 months and is a key test in managing diabetes. 107. A patient with type 2 diabetes is prescribed glympuride. What is the primary action of this medication? A. It increases insulin sensitivity. B. It reduces the absorption of glucose in the intestines. C. It stimulates insulin release from the pancreas. D. It inhibits the liver's production of glucose. Answer: C. It stimulates insulin release from the pancreas. Rationale: glympuride is a sulfonylurea that stimulates the pancreas to release more insulin, which helps lower blood glucose in type 2 diabetes. 108. A diabetic patient is experiencing nausea, vomiting, and fruity breath. Which condition should the nurse suspect? A. Hyperglycemia. B. Diabetic ketoacidosis, DKA. C. Hyperosmolar hyperglycemic state, HHS. D. Hypoglycemia. Answer: B. Diabetic ketoacidosis, DKA. Rationale: fruity breath and gastrointestinal symptoms, like nausea and vomiting, are characteristic signs of DKA, a serious complication of type 1 diabetes. 109. A diabetic patient is asking about the benefits of exercise in managing diabetes. What is the nurse's best response? A. Exercise lowers blood glucose by improving insulin sensitivity. B. Exercise should be avoided in diabetes to prevent complications. C. Exercise only helps with weight loss, not blood glucose control. D. Exercise raises blood glucose levels, so it should be done cautiously. Answer: A. Exercise lowers blood glucose by improving insulin sensitivity. Rationale: regular physical activity helps lower blood glucose levels by improving insulin sensitivity, which is beneficial for both type 1 and type 2 diabetes. 110. A diabetic patient is experiencing blurred vision and difficulty concentrating. What is the most likely cause? A. Hypoglycemia. B. Diabetic retinopathy. C. Hyperglycemia. D. Diabetic neuropathy. Answer: C. Hyperglycemia. Rationale: blurred vision and difficulty concentrating are common symptoms of hyperglycemia due to the effects of high blood sugar on the eyes and brain. 111. A diabetic patient is being treated with insulin. What is the primary function of insulin in the body? A. It stimulates the liver to release glucose. B. It helps cells absorb glucose for energy. C. It increases the breakdown of fat for energy. D. It decreases the body's need for carbohydrates. Answer: B. It helps cells absorb glucose for energy. Rationale: Insulin allows glucose to enter cells, where it is used for energy. Without insulin, glucose cannot enter cells, leading to high blood glucose levels. 112. A diabetic patient is on insulin therapy and is asking about how to avoid hypoglycemia. What is the best advice? A. Take insulin only when your blood glucose is high. B. Always carry a source of fast-acting carbohydrates with you. C. Exercise only after taking a dose of insulin. D. Avoid eating any carbohydrates to prevent hypoglycemia. Answer. B. Always carry a source of fast-acting carbohydrates with you. Rationale. Carrying fast-acting carbohydrates helps prevent and treat hypoglycemia, which can occur if insulin lowers blood glucose too much. 113. A patient with diabetes is asking how to manage stress. What should the nurse emphasize? A. Stress can raise blood glucose levels, so it's important to practice relaxation techniques. B. Stress does not affect blood glucose levels. C. Stress should be avoided by any means, including staying at home. D. It's best to increase your insulin dose when you're stressed. Answer. A. Stress can raise blood glucose levels, so it's important to practice relaxation techniques. Rationale. Stress increases the release of hormones like cortisol, which can raise blood glucose levels. Stress management is essential for blood glucose control. 114. A diabetic patient is receiving an insulin infusion. What is the priority nursing action when administering for insulin? A. Monitor blood glucose every 30 minutes. B. Administer insulin through a peripheral foreline. C. Rotate insulin infusion sites every 24 hours. D. Administer insulin at a constant rate, adjusting as needed. Answer. A. Monitor blood glucose every 30 minutes. Rationale. Continuous monitoring of blood glucose is crucial to ensure that insulin is effectively managing the patient's blood sugar levels. 115. A diabetic patient is prescribed liraglutide. What is the main action of this medication? A. It stimulates insulin secretion from the pancreas. B. It increases the body's sensitivity to insulin. C. It mimics the action of glucagon-like peptide-1, GLP-1. D. It inhibits the absorption of glucose in the intestines. Answer. C. It mimics the action of glucagon-like peptide-1, GLP-1. Rationale. Liraglutide is a GLP-1 receptor agonist that helps increase insulin secretion, reduce glucagon release, and lower blood glucose levels. 116. A diabetic patient asks about the use of continuous glucose monitoring, CGM. What is the nurse's best response? A. CGM helps track blood glucose trends, providing real-time data for insulin adjustments. B. CGM is only necessary for people with type 1 diabetes. C. CGM is not useful unless you experience severe hypoglycemia frequently. D. CGM replaces the need for fingerstick blood glucose checks. Answer. A. CGM helps track blood glucose trends, providing real-time data for insulin adjustments. Rationale. Continuous glucose monitoring provides real-time data that helps patients manage their blood glucose levels more effectively by detecting trends. 117. A diabetic patient has a blood glucose level of 40 milligrams per deciliter and is lethargic. What is the nurse's first action? A. Administer 15 to 20 grams of fast-acting carbohydrate. B. Call the healthcare provider immediately. C. Administer a dose of insulin. D. Place the patient in a recovery position. Answer. A. Administer 15 to 20 grams of fast-acting carbohydrate. Rationale. For hypoglycemia, the first action is to provide a fast-acting carbohydrate to quickly raise blood glucose levels. 118. A patient with type 2 diabetes is being prescribed empagliflozin. What is the primary mechanism of action of this medication? A. It inhibits glucose absorption in the intestines. B. It blocks the renal reabsorption of glucose. C. It stimulates insulin release from the pancreas. D. It increases the breakdown of fat for energy. Answer. B. It blocks the renal reabsorption of glucose. Rationale. Empagliflozin is an SGLT2 inhibitor that reduces blood glucose by preventing glucose reabsorption in the kidneys, leading to glucose excretion in the urine. 119. A diabetic patient is prescribed liraglutide. What should the nurse monitor closely during treatment? A. Blood pressure. B. Serum potassium. C. Liver function tests. D. Blood glucose levels. Answer: A. Blood pressure. Rationale: liraglutide can cause a decrease in blood pressure, so it's important to monitor blood pressure during treatment. 120. A diabetic patient is admitted with a blood glucose level of 600 milligrams per deciliter. What should the nurse suspect? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Hypoglycemia. D. Normal glucose level. Answer: B. Hyperosmolar hyperglycemic state, HHS. Rationale: HHS is characterized by extremely high blood glucose levels, dehydration, and absence of significant ketosis, typically seen in type 2 diabetes.